Wuhan provides hope for the rest of the world that even the most severe situation can be turned around.
Good afternoon, everyone. I hope you guys are taking necessary precautions for coronavirus. Today it's 22nd of March 2020, and as you all know, today our Prime Minister Narendra Modi has announced as Janata Curfew, which means all the citizens of India and all the foreigners who are in India right now should stay inside their home. So meanwhile, our Prime Ministers, and it is our social responsibility to thank all the doctors, all the medical team and all the medical facilities for saving our lives, and also to the police force who are watching our backs and giving their time abundantly to the patients of coronavirus. So before I start with today's video, as you all know the present scenario due to coronavirus, so today I'm gonna give you a brief outline of coronavirus, like how it outbreak in China and right now all across the globe. So the potential outbreak of coronavirus started at Wuhan Central Hospital when a doctor named Dr. Li Wenliang found out some of the abnormal symptoms in his patient. Lately, he has forwarded these abnormal symptoms to his group of doctors in the Wuhan Central Hospital. And after a couple of days, the police came and the doctor was taken to the custody and accused for giving false statement. And Dr. Li was warned for giving the false statement. Lately, after a couple of weeks, Dr. Li was confirmed that he had the virus within him, which means he has diagnosed with coronavirus. So later on the 31st January 2020, WHO, that is World Health Organization, has declared global health emergency.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Now, as we are talking about coronavirus, what actually coronavirus is? Coronavirus is a large group of virus which is very common among many species of animals, including humans. And this clip we're going to be talking about what are the symptoms of coronavirus and what can be the preventive measures of coronavirus. In the late December 2019, a group of people was suffering from severe pneumonia. Investigation found that this was caused by unknown virus, and they have named this as novel coronavirus 2019. Keep that in mind that novel coronavirus 2019 is a new virus, and what's known about the virus as of now might change in the later period of time after all the research work. Now, as I speak about coronavirus is a large group of virus. Structure-wise, it consists of genetic materials called RNA, that is ribonucleic acid, which is surrounded by an envelope with protein spike over it. The protein spike on the envelope appears as a crown. So crown in Latin is known as corona, hence the name become coronavirus. There are different types of coronavirus that cause respiratory and sometimes gastrointestinal infection. In case of respiratory disease, it shows the symptoms of mild fever, common cold, and leads to pneumonia. However, there are some kind of coronavirus that cause severe disease and finally leads to death. This includes SARS, that is severe acute respiratory syndrome, which was first found in China in the year 2003, and secondly MERS, that is Middle East Respiratory Syndrome, which was found in Saudi Arabia in the year 2012. The 2019 novel coronavirus was first identified in China. It initially started in a group of people with pneumonia who had been associated with seafood and live animal market in Wuhan, China. The disease has since spread from those who were sick to others, including family members, friends, and healthcare staffs. At the moment, there are lots of cases of coronavirus in China and also in many other countries. Now, where did the virus come from? Earlier, it has been reported that coronavirus is present in many animals. Sometimes this virus can circulate from animal to human, and this process is called spillover. It can be due to many factors such as mutation in virus or close contact with human and animals. For an example, MERS, that is Middle East Respiratory Syndrome, was known to be transmitted from camel, and SARS, that is Severe Acute Respiratory Syndrome, was known to be transmitted from civet cats. However, the cause of 2019 coronavirus is not yet known. Meanwhile, many doctors and researchers have claimed that coronavirus 2019 is transmitted from bat. Now, how is the virus transmitted from animal to human being? The exact mechanism of transmission is yet to be determined. Usually, respiratory viruses are transmitted by droplet created when an infected person cough or sneeze, or through something that is contaminated through the virus. Now, as you know, the virus is transmitted via small droplets, so people who are close contact with animals are most at risk to be infected, such as live animal market worker. Secondly, those who look after the infected patients, for example, the healthcare worker and family members. Now, let's go through the symptoms. There could be number of symptoms ranging from mild to severe. As of now, we know that it might start with mild or respiratory symptoms such as headache, fever, cough, or shortness of breathing. In severe cases, there had been reported pneumonia, kidney failure, and lead to death. However, the mortality rate is not yet confirmed. Now, how do you confirm whether someone is infected? Infection can be diagnosed by a test called PCR, that is polymerase chain reaction. These tests identify the virus based on their genetic materials. So in this case, the genetic materials is called RNA, that is ribonucleic acid. Currently, there is no specific medication available except supportive care. However, vaccines are in the process of developmental stage. Now, coming to the preventive measures. The new COVID-19 virus has a limited geographical spread. However, there's a standard hygiene practices that have been recommended to protect against the infection and further spread. These include covering your mouth and nose while sneezing or coughing with your mask, tissue, or flex elbow. Secondly, maintain distance with those who are unwell or sick. Third point is use appropriate mask and personal protective equipment, especially in healthcare. And fourth point is wash your hand frequently with soap or 70% alcohol. And avoid unnecessary contact with animals, or make sure you wash your hand with soap or 70% alcohol after contact with animals or animal product. And also make sure that before consuming any animal product, you should cook the food thoroughly. There is one more important preventive measures. That is, if you are not well, you should stay home back. But if you have a fever, cough, and difficulty in breathing, you should immediately contact the medical facilities. And this report from the official website of WHO shows that the number of confirmed cases is almost gonna hit 2,95,000, and the number of death is gonna hit almost 13,000 cases, and spreading over 187 countries as of now. As I'm recording this clip right now, the number of death might increase and the number of cases might increase more.